When providing patient counseling, it is important that you follow a process or that you have a process to ensure that the counseling session that you provide is consistent with what the patient may be needing help with. So in this video, I provide simple steps that you can follow or you can apply when doing that. So in step one, the introduction stage. This is where you're greeting the patient. You are introducing yourself and you're making sure that the patient feels comfortable. The reason for doing this is to build trust and to understand how the patient is feeling or what they need help with. You're also doing this to assess the patient concerns. So you're not just counseling the patient on anything, but you're counseling the patient based on the needs that they may be having. In step two, the information gathering stage, this is where you ask the patient questions and you listen attentively. You are hoping to find out about their condition, their medication, and any potential problems that they may be having. The reason for doing this is to understand the patient so that you can be able to provide effective counseling. And you're also identifying any potential problems that the patient may be presenting with, whether with the medication, the condition, or maybe they don't know how to use the medical device that the doctor has prescribed. And then in phase three or in step three, you are developing and implementing a plan. Now you are deciding what to do based on the information that you have. You are addressing any problems and guiding the patient during this process. The reason for doing this, like I said, is to resolve any problems that the patient may be presenting with to ensure that the counseling session is tailored to the patient's needs. In step four, you are providing information and obtaining feedback. This is where you explain how to use the medication properly, how to use the medical device that is prescribed. And then you're going on to obtain feedback from the patient to ensure that they understand the information that is provided here. The reason for doing this is to ensure that you provide information on the safe and the rational use of the medication and the medical device that has been prescribed by the doctor here. And step five of this counseling steps is the closing stage. So here you are summarizing any information that you feel the patient needs to know. You are asking if they have any questions related to the counseling session, and you're ending the session well. The reason for doing this is to ensure safety as well, to ensure and explain and demonstrate that the patient is supported throughout this process, and you are encouraging the patient to come back if they have any questions or they have any further things that they would want to ask or want to be addressed by you. So I hope this helped while you do domain 2.0.